Good evening, and welcome to all of our reopening committee who's joining us on this as panelists tonight, and to our staff who are joining us as well. I want to start on time because we do have a hard stop right at 7 o'clock, because at that point we will switch to the community questions and the community Q&A. So Sasha, let's go ahead and get started if we could, and thank you for controlling this meeting for us tonight. For those of you who have not been following along, this is just a graphic that we show at the beginning of all of our meetings, where it has the district task force in the middle. And our task force, we have, our school nurse, our doctor consultant, Karen Hirsch, who is our Board of Education representative, all of our senior members of cabinet. And then we take all of the inputs from, when you look at those white boxes on the outer edge, from everything from our principals on scheduling, transportation department, food service. And as you look around, it's really inputs across the district, and we've worked really hard to try to have a lot of focus sessions, surveys, so that we're really hearing from large groups of people. And on the dark blue, what you're looking at are really those 4 priorities. On the top right is to maintain health and safety guidelines as we go through this process and figure out what it's going to look like this fall. Our enhanced focus on social emotional learning, high quality programming for all ages, whether that's face-to-face or remote, and the analysis of the achievement data to close the gap, accelerate the pathway, and maximize learning gains for all students. Go ahead, Sasha. Just some important resources and upcoming dates. Our return to school planning website, there is a robust, it's a robust website with lots of information. And again, I encourage you, if you're going to go back and look at documents, start with the most current, because some of the documents that are on there could have an old Q&A, or it could have something that is now out of date, because we literally get updates, I would say almost every day, definitely a couple times a week. We have some video resources on there, everything from how to wear a mask, washing hands, that we're going to be utilizing with our students, especially our little ones. Also with our human resources, there's information about how to contact information for those of you that need it. And then some of the important dates down at the bottom are families are completing their online form to determine return to school status, and so are our parents for their children. We have our August 27th is still our first day for teachers, professional development. And we did extend the calendar year, which I think most of you are aware of by now, with September 8th, right after Labor Day, being our orientation day. And September the 9th is a first day for all students. And right now we're planning GHS in a hybrid model, which means their first week will be modified to look a little bit different because once orientation is over, that would give us Wednesday, Thursday, Friday, which means one group of students would not be on campus. So we want to make sure that both red and white group have the opportunity to be on campus that first week. So some of the latest information from the Connecticut State Department of Education. Governor Lamont met with superintendents from this region, about 10 of us this past Monday, very gracious with his time. He met with us in person and really listened to some of the challenges that school districts are facing, and why in some circumstances hybrid, a hybrid approach is going to be necessary in order to implement the safety precautions that we need. We had those discussions about flexibility with districts. And at Greenwich Public Schools, we are requesting a hybrid model for Greenwich High School. We're scheduled to have 2,800 students in the building, 400 staff, and in high school, it's almost impossible to cohort students given the complex scheduling. And we are also connected with Commissioner Cardona last night just to get clarity on our hybrid model. And there's been a lot of confusion about that this week. The governor did make a statement late Monday that he was going to give some flexibility, especially for high school in the hybrid. But then yesterday we had a statement from the Connecticut State Department of Education that still was saying everybody must be in 5 days a week in person. Again, we had clarity on that again today. So it looks as though we are going to, at least on the high school level, have some flexibility. And we're supposed to get more information about that again tomorrow. Some of the frequently asked questions, they really fall into these 5 categories: cleaning of facilities, curriculum and learning, health and safety, remote learning in our school schedules, and teaching and personnel. So we have pulled out some of the frequently asked questions. Again, we had almost 500 questions that were submitted, and we took those, consolidated some that were the same question, worded perhaps a little bit differently, into a Q&A document that went out to the community, to our staff last week. It's 20 some odd pages, but these are some of the most common questions. First of all, what and who will ensure that our classrooms, hallways, chairs, tables, doorknobs, and bathrooms be cleaned and sanitized? And, you know, will lids be added to the toilets, paper towels instead of the moldy air dryers that just blow germs all over the room? So our answer for that is that the building will be disinfected every evening with a product that's considered safe and non-toxic. And it is also proactive in eradicating COVID-19, the virus. And I will say some people will consider this as electrostatic disinfectant. You'll hear it in those terms. And it's a very high quality disinfectant. Hand sanitizing will be available at entry and exit points and within all classrooms. In the restrooms, we had already disconnected our hand blow dryers. They were turned off. We're making sure the bathrooms have no touch paper towel dispensers. So when you grab a towel, the next one comes out. We're installing the tissue grabs outside of restrooms so that you can grab the tissue and not have to use your hand directly on the door as you enter the restroom. We have posted for 13 temporary custodial positions, which are being hired to assist all throughout the school day across the district. And again, that's to do nothing but help us with just this cleaning component in our buildings. The protection plan and protocol with safety measures. And these are, again, questions that we get a lot. Are we making appropriate considerations for, like for PPE, masks, gloves, hand washing schedules, plexiglass or acrylic screens for every student or faculty desk? Right now, go ahead, Sasha, thanks. Right now, we are in the implementation phase in our buildings, and we do have on stock actually mask, gloves, and hand sanitizer. And hand sanitizer will be available in every classroom. Wipes will be available in every classroom, so the teachers have access to that. We do have screens, clear dividers on some desks as they're needed, where we may feel like to have a smaller group work together. They will be available, or especially for those unique spaces like speech, for instance, where it's important that there be a little bit closer proximity between the teacher and the student. And then direct signage is used on the floor to help staff and students move about the building. And the 3 pictures that you're looking at the bottom, those are actually equipment that we have, and the taping is actually one of our buildings where you can see the footprints, helping kids know which way to go in the hall, and then the center striping, so that we're teaching students to hug the wall without touching it, but to make sure directionality is maintained, again, for social distancing. And then you're looking at 2 types of plexiglass dividers. The one in the middle is one you would see more often, for instance, in a speech where they may actually have a glove and want to hand something underneath if they need to. It sits right in front of the teacher and the student. The one on the left is a divider that actually could sit on a desk. For instance, if 2 students need to face each other instead of both facing forward, it's clear on the front and is actually clear on both sides. You can't really see the sides in this picture. And will the classroom teacher be responsible for disinfecting parts of the classroom between cohorts of students? What about after lunch? The intense cleaning really happens every evening, and that's by the custodial staff. And we have really safe chemicals. Again, they're safe, they're non-toxic, but we really don't want to be disinfecting all day and spraying constantly where our students are sitting, breathing, learning. This level of cleaning in between every class could cause excessive buildup, and we just want to be conscious of that. This is really why the cohorting model, especially at elementary and middle, is important, in that the number of students that you are mixing with. And again, the important piece is really having on the mask to make sure that you're not having the droplets in the air. Staff will need to be cognizant of allergies in the classroom, and if we need certain safety mechanisms, we'll work with the nurse at each building, and just like we do in the cafeteria, make sure those protocols are in place. And I will say right now, we are anticipating that likely K-5 could be eating in the classroom on several days, and it depends on the building, size of the cafeteria. And that's just because by the time you cohort with a mask when it's off and you cohort 6 feet, the cafeterias are fairly small, and you know, we can't have 20 lunches with children eating at 9:30 and finishing at 2:30. So it's just a matter of scheduling. For our youngest students, will they be able to work in centers or groups within their cohort, or will they need to stay 6 feet apart? With the mask on, and it's one reason that Connecticut says, you know, they really reinforce the mask wearing, is that it's really a 3 feet social distance, and certainly you could go up to 6 or 10. There will be some centers and groups which can occur with safe practice, including with those clear dividers that you just saw. The picture on the bottom is actually one of our classrooms that you can see. This is like a kindergarten room. Now, granted, every building has different tables, so your rooms aren't all going to look exactly the same building by building. But this just gives you an idea where there is a buddy at the table and they're still socially distanced. So certainly, you know, it's not like they're being totally isolated, and especially this question was based on those youngest learners. In middle school, we're trying to keep our class sizes down so that you also maintain that 3 feet distance. And in high school, obviously with only 50% of the students on campus, you're going to have half of the class. So it's pretty easy with the furniture at high school in order to social distance as well. This is an ALP question. So if a child's in the ALP program from one area but not all, how's that going to work if he's cohorting with the ALP teacher? And I know some of the ALP teachers are probably on tonight. We did have a meeting with many of them this morning. So if you're in ALP, go ahead, Sasha, thank you. If the child is in ALP and they qualify for one area, they will go ahead and stay for humanities, math, and science. And they'll be assigned a homeroom teacher. So they'll have their ancillary activities, their electives, morning meetings, will be with their homeroom. They leave that cohort to travel to a secondary ALP cohort. And that's partly to also minimize just the passing in the hall and kind of having a super block of time. And so safety protocols will remain in place, all the masks, social distancing, washing hands. We're also minimizing material sharing, ordering additional materials. We will, for ALP, use larger areas like a media center, again, just to space students out that much more. And another question we have received quite often is, will ALP be provided to remote learners? And yes, it will. How will teaching children with learning differences be handled? Will students be going back to school fully? How can accommodations be put in place for hearing impaired students who depend upon lip reading in order to interpret language? We've had a lot of special education questions, obviously, through our Q&A, and I will say, you know, thanks to Mary Ford, who held the first focus group with a group of special education parents through our PTAC representatives, and then they wanted to meet again. And so today, I believe it was their third or fourth focus meeting. Was it their third one, Dr. Carabello? Fourth. So they have been meeting weekly just to help answer some of the questions and to help guide our process for reopening. All students with support needs will receive services through the format. It may not look exactly as it did pre-pandemic, which I think we even know for summer school, which we're conducting face-to-face, it's a little bit different. We will have to follow all the safety guidelines from the state. Certainly, whether we're at low risk, moderate risk, or a high risk special ed services, special education services can look different. Individual arrangements will be made for those students who have unique learner needs, and we'll work directly with those families if the building is open and they need to be there on a day where they wouldn't normally be scheduled, and that's how their service needs to be delivered, then absolutely, we'll find a way to make that work. And we have been sharing, again, plans and strategies given all the strict guidelines. And we're really a network here in Fairfield County working together. For our hearing impaired and our speech services, we did order and use a variety of masks we have during the summer, during our summer program. Shields, masks with plastic inserts so you can actually see the mouth. We've ordered more of those because they seem to be highly effective. And just as a reminder too, we also have FM systems, and we have some of the best FM systems. So we think we are going to be equipped very well. Currently, what will mask wearing procedures look like? The Connecticut State Department of Education, and really the governor also, is requiring that masks be worn while we're inside the school building and while riding the bus. And again, it's a requirement. It's not something that the district is not making that choice. We are going to provide mask breaks throughout the day. Those opportunities will be instructed by teachers. Your building principals and leaders will schedule those in so that people understand when those breaks can occur. But we do know, masks aren't easy to wear all day, and so that's going to be important. If students are willfully not adhering to health and safety protocols, they will be referred to the school administration similar to any other behavior infraction. And this is really coming even from a legal standpoint. We do have an obligation under the law to enforce the wearing of masks for staff and for students. And yesterday we did get some more guidance that preschool could be exempt if necessary. We are still going to require a mask for preschool for the highest safety standard because our preschools are in our K-5 environments and they're not in a standalone early childhood buildings. And again, we're going to work with all of our students to do the very best that we can to make sure that mask wearing, which is one of the strongest deterrents of passing the virus, is making sure people wear their masks. And if they have a medical reason from their doctor, there could be a student who is exempt. And again, we will be working with families on this. If it becomes a real challenge, then that is where we will be encouraging those families that really can't comply or are struggling in the school environment to opt for remote learning. We will have masks available if students or teachers forget their mask. We are asking that families and teachers go ahead and bring their own mask, wear their own. And this strategy is helpful for a couple of reasons. First of all, it helps the student recognize his or her mask and mitigates them getting mixed up because all the masks look alike. The other aspect to that, most of us have probably figured out that not all masks are created equal in terms of how they feel. A mask that feels okay on one person may be too hot or too heavy on another person. And we feel like having that individuality is going to be better and safer for us. But if a family needs assistance in acquiring a cloth mask, we absolutely will provide one. And again, they will be available for people that want them if they want to wear perhaps the lighter blue medical mask. They will be available. The protocol for a positive test in either a student or a teacher. And this is when I'm going to turn it over to Mary Keller. Mary, if you can kind of walk us through what that protocol looks like. I'm sorry, you're muted, Mary. You're still muted, Mary.
Now? Did you hear? Can you hear me?
Yes.
Yes. Okay. I apologize. I was trying to be polite here. A positive test indicates that you have currently, most likely, have an infection. The incubation period for that infection is anywhere from 48 hours before you're symptomatic and through day 14. Generally, it's you become symptomatic sometime between day 2. The mean average is day 5. So we're trying to, by making this quarantine 14 days long, we're trying to cover the whole period. So anyone with a positive test is considered infected and would go home and stay. Anyone who has a positive test, we notify the health department. We have made plans to notify the health department should someone be possibly infected. For example, if we had someone who came down with symptoms during the middle of the day, during school, and we suspected that they may have COVID based on our assessment, based on our exam, based on the history that we got from them, then we could notify the health department and ask them if they would sort of begin the contact tracing. But every positive test is reported to the State Department of Health. They then report it to the local Department of Health, and the local Department of Health will begin contact tracing. They will contact anyone that the person has been in contact with, and they will monitor the family of that person for symptoms through that 14-day period. In an effort to catch it before it happens, we have asked families to do a symptom survey on the honor system. They will have a copy of the symptoms, a few questions on whether they've been exposed, whether they've been out of the country or out of the state in some of the high-risk areas. And when they come back, we would ask them to quarantine for the 14 days before they could return. Health alerts would be sent out if we have a positive case. We would notify parents if there is someone who's been exposed. And the decision as to the level of quarantine of the other people who were possibly exposed would depend on, there's a lot of factors that go into it. One being how close were they? How long were they there? How long were they exposed to that person? Is it greater than 15 minutes? Were they wearing a mask? You know, was the person coughing or sneezing, or was the person asymptomatic? So that decision would be made with a lot of input from myself, from the medical advisor, and the health department as to what that exposure was and what the level of quarantine would be. We would assume that it's going to be 14 days, but it could be less in those cases where we assumed that part of that cohort was not really, had a really low risk exposure. I think I talked a little bit about if a student developed symptoms during the day, they would be sent down by the teacher. It would be, we would request that every teacher call us before they send a student down that they suspect might have, you know, coughing, sneezing, runny nose, or a student says, oh, by the way, my mom thinks she has COVID. Those students would immediately be sent to the nurse with a phone call. We would, if they weren't already wearing a mask when they got to the health office, would immediately be put in an isolation room. The nurse would be in full PPE and examine the patient, call the parent, ask the parent to pick up the student as soon as possible. The parent would not come in. We would have the nurse walk the student out to the parent and request that the student be evaluated by their physician. And get a note from their physician in order to return to school. We will not be doing testing on students. We just can't do that. It's not in our abilities or our practice. Do we have the next slide? Okay. This is a great little slide that tells you, you know, how to look at it and when you should be staying home, when you should be coming to school. Initially, there's going to be a lot of false positives and a lot of false negatives. We understand that initially every runny nose and every cough and every sneeze might actually end up in the nurse's office, and we understand that, but we'll get better at it. You'll get better at recognizing, you know, what's true, but we would appreciate anyone who you're suspicious of to give us a call, and we will, you know, we will examine them, make the assessment, and if there's a few false negatives, everyone will just have to be understanding as we go along with this. I think we talked about if you're positive, you become quarantined, and student or staff should contact their administrators for discussion for any, potentially approved exemptions. We are asking for a doctor's note from anyone who has a medical reason why they can't wear a mask, but we will also try and accommodate. I think we have to be understanding that masks are difficult for everybody, and we will try and get some sort of mask or some sort of protection for any student who is having difficulty. We have to remember that that's just one of our strategies. There's distancing, everyone else is wearing masks. So there's a lot of mitigation strategies and tools we sort of have in our arsenal that we can use when someone's having difficulty with masks. On the other slide is the daily self checklist. I understand it's up on the website if you'd like to take a closer look at it, but it does outline all the questions that we would ask and of staff and and families to identify if they have any symptoms, including a temperature check. And we do have a few thermometers that if there's a family that is having difficulty and doesn't have a thermometer, we'd be happy to make it available to them any way we can help.
Great. Oh, sorry.
Sure. Go ahead.
No, I was just going to say thank you, Mary. I'm gonna go ahead and go to the next slide, just because I'm trying in the next couple of minutes to take some live questions as well. Very thorough. Thank you. After making appropriate considerations with enforcing social distance learning, are you making appropriate considerations? We will have multiple points of entry and exit into each building. Again, each building is unique. So how many points of entry will be based on how the building is arranged and where it makes the most sense, working with safety, security, and health. Our main offices, nurses' offices, our GHS house offices, service provider spaces, we'll have those clear dividers just like we did for summer. And again, especially for those ones that are working in one-to-one settings, like speech, for instance, we are modifying the schedule to adapt for social distancing. And what that means would be an example, for instance, at middle school, everybody doesn't pass in 6th grade at exactly the same time. Those passing times are modified, so it's only one cohort of students who are passing in the hall. And then when they're in class, the next cohort is passing. So the schedules have been adjusted to accommodate for that. And additional staff are being added in K-5 to assess with grouping numbers. We've been trying to keep our groups as small as possible. And, you know, just as a reminder, square footage is also just as important as class size, in that you can have a classroom that's 1,100 square feet, especially in an area like kindergarten, but then perhaps in 7th grade or in high school, we can have a classroom that's 700 square feet. So the number of students that they hold also looks at the square footage, which we are looking across the district, also in areas like our cafeterias. Class sizes are being limited so that we get a more balanced schedule. We're doing that in middle school, also by adapting the way electives are programmed to start the year. And probably next week, for those of you who have a lot of interest in the scheduling, we're working on getting another reentry meeting. Those usually happen at 10 in the morning, where we're going to go through a little bit more depth about our middle school schedule, high school schedule, and we'll circle back over our elementary schedule as well. Also, principals will be encouraging outdoor activities, of course, but it has to be scheduled, because we also can't end up with half of a school outside at the same time where we're not social distancing, because when they're outside, that is a mask break area where they could take a mask off. But also, we're not planning on outdoor space as permanent space, because we have to pay attention to heat alerts, stormy weather, and the school just having access, again, has to be scheduled. And we also need those outdoor spaces, especially in elementary and even middle school lunches, for recess and for those mask breaks. But we do want to utilize outside as much as we can safely. What is the process and procedure for remote learning? And remote learning is kind of interesting in that you're hearing us call it remote learning because the state actually changed language. We were calling it distance learning. They changed to remote, so we feel like we need to utilize their language. It's still kind of confusing. We have reached out to all the families for their commitment about returning to school either live or they choosing to go with a remote school. And the decisions are due by August 7th. And we're getting a lot of emails every day just with wonderful questions, and we'll continue to work with our families to answer those. The same curriculum will be taught in either scenario. If a student needs to transition in or out of remote learning, there is a conversation. If they're with an actual remote teacher, the sending teacher, receiving teacher would have a conversation. We have given ourselves a 2-week notice period. So if a family opts out for remote learning and they're ready to come back, we want to make sure we have space for them. If it's a high school student, that we have them in a schedule, because we're going to be dealing in a district of our size, we could be dealing with a lot of in and out. A family may start in remote learning, 4 weeks later say, I feel really comfortable, things seem to be going well, I want my student back face-to-face, and we could also have the reverse. And the state has been very clear, and we've had legal guidance. Families may come in and out as much as they want. So where in some states they're saying families must make commitment, for instance, for 9 weeks or a semester, we are not allowed to do that in Connecticut. So we're gonna have to be very flexible. And we are striving for that minimum balance of 50-50 synchronous, asynchronous, much more live teaching going into the fall. So if you have, for instance, a 45-minute period, when I say minimum balance, you may be on live with students for 30 minutes. In the last 14 minutes, you're working with small groups, breakout groups, as they're doing their independent work. The remote learning teacher will also have opportunities for social interaction with other students. Their morning meetings, their read aloud, all of those sorts of things that we, especially in elementary, the way you start your day. And the district has compiled a list of digital tools that will be leveraged for daily use at each level. And again, this is getting feedback and survey data from staff and families. And for when we did our elementary feedback session, our K-1-2 teachers were very strong that we needed Seesaw. And at the point in time, we weren't sure if we were going to be purchasing Seesaw just because it was something new for us. We wanted to hear the feedback first. Once we heard the feedback, we knew it was something that we really needed. And we have several platforms where, you know, thank you to those staff who joined in on those focus calls. You really did help guide so that we're prepared to give you what you need in the fall. And those are online as well. And we will be posting more about what those tools are. And what's the process and procedure for remote learning? Sorry. Can we take hybrid approach, and how will schedules work for each level? So we are working for a full replan to school for elementary and middle, and a hybrid for high school. And should health, the virus change in this region, this plan is always subject to change. And again, this is working with the Connecticut State Department of Education and the governor. And the expectation has been all along that all grade levels, not just K-5 or 6-8, would go back full time. And just this week, they have had some flexibility in saying, especially in high school, that they'll consider the hybrid, which we were really thrilled with that they're listening to district. But we are modifying schedules again to minimize, you know, cross grade groupings, busy halls, all the things that we know don't work in order to try to social distance. Our electives are being scheduled differently to minimize how teachers move across the grades. They will be much more restricted to start the year, because our goal is making sure the core content, we can get our doors open and really with minimal movement, trying to reinforce social distancing and the things that we need. At the middle school, the cohort will not exceed that approximately 100 students, and we're cohorting by those teams. And at high school, we're working toward the hybrid approach, as cohorting is not feasible for scheduling. And at the high school, we're working towards a hybrid approach. And you'll see down at the bottom, you can see what that schedule would look like. So the current schedule is to do 2 days in school. Then Wednesday is a full building. We're disinfecting that day. And the teachers are online with the students. And then 2 days remote, Thursday, Friday. Again, this allows us to not have cross-contamination between the cohorts. And if you look down at the bottom, on Monday, Tuesday, you would have your red group face-to-face, and Monday and Tuesday, and this is done by alphabet, so that if we go hybrid across the entire district, because COVID is starting to really start up, families are on the same schedule. The white group would be streaming into the classroom. On Wednesday, it's full remote learning, much more where you would think about a Google Meets or Zoom. And then again, Thursday it flips. The white group is face-to-face, the red is streaming. And this schedule has been set up intentionally, and I may have this on a slide here in a minute, but to really think about what is the best schedule that works from a social emotional standpoint, but also works academically. And the 2 days in and 3 days out, what this does is it allows us during to have that 5 to 5.5 day window. And we know that, again, this is coming from our health professionals, and thanks to Mary Keller, who did some research on this just about a week or two ago, again for us, that we know most individuals are going to show their symptoms by day 5. So if the student is in Monday, Tuesday, then they're off Wednesday, Thursday, Friday, Saturday, Sunday. it is highly likely their symptoms are going to show while they're not in our building, which is going to be very helpful, again, as a mitigation strategy. The same for those students who are in the building Thursday, Friday, then they're not in the building Saturday, Sunday, Monday, Tuesday, or Wednesday. And again, it's that 5-day window when they're most likely to see their symptoms. And we feel like this strategy is, from the health professional standpoint, a safe one. Why isn't the health and safety of the entire GPS staff a higher priority than returning to school before it's safe to do so? This has been a challenge this entire planning time. Health and safety is a priority for everybody, but what I can say is, you know, requirements are changing weekly, including this week. And we have had a mandate for a full return to school. It's not been an option for the district. And we still don't have our clear guidance, and we're supposed to get some more. We have advocated for a hybrid schedule for the high school instead of a full return. And even though we've been told, you know, that it would not be in compliance, we've stayed committed to that and really tried to, again, work at the state level. And I'm really grateful this week that they seem to really be working with the districts in our understanding. But teaching will need to look different. The teacher needs to stay in the front of the room. A lot of teachers are not used to doing that anymore in that safe zone, which maintains 6-foot distancing. Although 3 foot is considered adequate if the masks are worn. And again, this is coming from health professionals. Will my sick days be impacted if I contract COVID? Will I expect to teach remotely? If I'm home being quarantined or sick, how should I handle needing to take a leave of absence for family matters or childcare? And there are quite a bit of information went out last week. So it came from Shemaine Johnson, our chief HR director. So if you haven't seen that, please make sure you go in and look at it. Some really important information. Under the Family First Coronavirus Response Act and collective bargaining agreement, teachers do have a series of options. And if an employee is high risk, they can request accommodations. But again, you need to do that through HR on a case-by-case basis. The state is working on supports for teachers right now who are having childcare challenges across the state of Connecticut. And again, this is something that is really new this week, as they were speaking with school superintendents across Connecticut saying we're concerned that people who teach in our district have their children in another district. That district closes, our district doesn't. How are we going to manage that? We all know how difficult it is to get subs when we're not in a COVID environment. So the state is looking at some supports in that area. And if employees who contract COVID are entitled to 2 weeks or 80 hours of paid leave. And if the leave goes beyond 2 weeks, then it would go into sick leave. But those 2 weeks are part of the COVID Coronavirus Response Act that people are entitled to. And I'm going to click on now, if you would like to submit a live question in the Q&A, right at the bottom of your screen, it has a Q&A, and there's about 57 questions in there right now. I just went to 58, I think. We're going to try to work through as many of those as we can. And again, we have a hard stop here right at about 7, but all of these questions will be archived. We will either add to our Q&A document if they're really different and have different sections, or we will create a new Q&A document just from tonight and also from the family meeting that happens next. So I'm going to start. So why can't an elementary model look like the high school hybrid? Partly because at elementary and middle right now, we're not allowed to do that. And just getting the high school hybrid, having a conversation that it's going to be allowed has been a challenge. They did put out a chart later this afternoon, and I can't say I've had a chance yet this afternoon to study it really carefully, but Mary Keller and I know both glanced at it, where it's kind of a decision tree about at what point you could go to hybrid or go to remote, and we're going to have to go in and look at that. But the state health department is trying to help us base those decisions off how many cases are in your local community. So for us, that would be as in Greenwich. So in the last week, somebody's asking about, there's been a spike in the week in cases in the 10 to 19 age group, and the cases are not cooperating with contact tracing, and asking how we'll respond to similar spikes in cases among the age group, and what are the implications of refusal. And it really is, this comes down to the health department, and Mary, you can feel free to chime in about the health department. You're trying to get them to comply as much as you can, but There is nothing, from my understanding, that we really can do if somebody is not forthright to help with the contact tracing. Mary, do you have anything to add to that, Keller?
No, I think that Carolyn is a little, Carolyn Baisley, the head of the health department, is a little frustrated, but she has been, she's been working with the students and, you know, the families to trace these kids. And we will be able to give her some of the contacts, certainly when we are in school, because we sort of have a captive audience. So it'll be a little bit easier for us to give her contacts sort of proactively.
Thank you, Mary. And these questions are coming in so fast, so I'm kind of jumping around because they pop up on my screen. But as far as the literacy support, ESL services, those services will still be provided just like our ALP services. And we will have some teachers who do work cross cohort. And I think it's important to note that just because we say that we have a cohort, that doesn't mean that students are never mixing with other students. What we're trying to do is mitigate as much as we can when those students are with us. But the reality is after school, they have athletic cohorts, they have Girl Scout cohorts, they have all types of cohorts, church cohorts. So there's still a lot of mixing that happens. We're just trying to mitigate as much as we can and still provide a high quality educational environment. So there's still our specialty teachers, some of them will go cross cohort, but we're trying to minimize as much as possible. And the other question that kind of goes along with that is about itinerant teachers and those teachers who travel between multiple buildings. We are trying to minimize that as much as possible, and we'll continue. We're continuing to do that. I had some questions this morning about just asking about contractual issues, if they're going to be in one building instead of two, you know, when they will know that. And again, HR is working on all of that right now as we determine which staff are actually going to need accommodations and staff that don't. And we're trying to get all of those answered first. So would the district consider a switch to all remote learning for the first 2 weeks prior to December break? This again would depend greatly on the state. The state at any point in time can come and tell us we're all going to be back in school 5 days a week. You know, for us to be in compliance. So as we get closer to the holidays, if Connecticut really doesn't have a spike, it's still sitting low, it's highly unlikely, at least based on my experience over the last few months, that we would be able to just send everybody to full remote learning just because we think it's best. Our health officials would obviously have to chime in on that, and we would have to have guidance from the commissioner and also from the governor. As far as the plans for health and safety at Windrose, Mary Keller is aware that there's not a full-time nurse there. There is also a part of the custodial is actually contracted in the contract at Windrose. So cleaning there will still be disinfecting, just like we do every other building. But yes, it is a little different because we have a contract with somebody else's building. Staff that work in multiple buildings, again, I've answered that one. So the high school's deep cleaning is because we've got 2,800 students. And when we say deep clean, it's really just disinfecting because the two cohorts are split, and we've given Wednesday to do it because of the sheer volume and size of the building. And the question is asking, well, when are the other buildings going to be done? They're done every night. Because it's much easier if you think about Parkway or our middle schools for us to go in and disinfect each evening. It's very difficult to do that at the high school just with the size of the high school. We have purchased, somebody's asking about shields and masks. I mentioned masks earlier. We have purchased shields, and we would have those available for those teachers that want them. You know, just as a reminder from a health safety standpoint, they would recommend a shield with a mask. Not just a shield. Doesn't mean you know, we couldn't do that, but because masks are required, you really would want to wear both. As far as pushing into classrooms to support students, again, what the principals, what the leadership teams are trying to do is have cohorts of students who are grouped with those extra providers and extra services, and they're working very hard on that from a scheduling standpoint. It's not easy. And again, it doesn't mean that somebody who's pushing in will not cross two cohorts, because they absolutely could. Will building administrators be seeking more feedback from staff? Absolutely. I think right up until school starts, we're going to continue to do focus groups. We're going to continue to survey, getting as much input as we can. And I know that each building level will have to have this type of meeting just with their own staff, because each one of your buildings are different. So plans to reduce class size. Our class size at elementary right now is averaging around 18. We set the goal to be 20 or less if we could, and we've done a good job of really managing that. It's one reason we also have the structure that we do with the Elk program, because we have these super blocks during the day when you have, you know, anywhere from 3-4 students that actually leave the classroom, which actually even brings that number down lower. So we feel like we have a very good strategy. And we talk about how summer school has gone and Finney students have been sent home. And we had not had anybody sent home for summer school. And it's gone really well, but it's been very tightly controlled for our related services that have been happening at COSCOB. And it's gone really well. Our distance learning aspect has gone well. I think, you know, lessons learned, trying different masks, trying what type of dividers do we really need on the tables? Do they need plexiglass or plastic, or how we enter the building? Once they loosened up taking temperatures where that was no longer a requirement, looking at how we're going to manage that, you know, in the fall and getting everybody in safely. We also realized that even with the temperature, I think any of us that work with young children or you've had children know that often if you just give the child Tylenol before they go to school, they're still not going to show a temperature. And that's what happens a lot with, you know, early childhood. So summer school has gone well, and I think we have learned especially about equipment. If they're required to quarantine due to exposure, but is not sick, will they be teaching remotely? This is something we're looking at right now. So if we have a teacher who had an exposure, perhaps in their maybe their family or their church, and they need to be at home, we're exploring how we could have that teacher actually live stream back into the classroom. If we did that, we still have to have a substitute, fully qualified substitute in the classroom, because we cannot use our support staff in those roles by their contract. So yes, we are exploring that. And again, it could become a challenge for us if we have a lot of teachers that were in that situation. Do we have enough subs? And that could be a reason why you end up going to distance learning, because the sub situation becomes a challenge. So in an earlier planning meeting, the district physician said COVID symptoms in elementary are often the same as a common cold. How are teachers and school nurses going to learn to differentiate the symptoms? And I think Mary Keller hit on that before. It's not going to be easy at the beginning. We do have the CDC sheet. If you look at what they've provided, it's a lot of the common, especially when we get into flu season. It's definitely going to be hard. Mary Keller, I don't know if you have anything to add to that at all.
I think initially we will probably err on the side of caution and being very conservative and sending children home to be tested as time goes on. If there may be some mixing with the flu. I'm hoping that some of the articles that are coming out saying that the flu, that people are taking precautions, such good precautions for COVID, that the flu symptoms might actually even be less. I'm keeping my fingers crossed for that. But, you know, we will figure it out as time goes on. The nurses have lots of experience looking at kids and telling the difference between, you know, allergies and whatnot. They'll figure it out. But I think initially we will have some false negatives, but we'll work it out.
Thank you. Will GHS have an open campus? I don't think their planning team has, you know, really settled on that yet. I believe that they're looking at starting the year definitely closed. And I know that it's also stopping some of the Uber Eats. We have a lot of deliveries that come in and out of the high school. Actually saying we're going to do it and actually doing it are two different things. But the high school is still working on strategies to see how they can mitigate that as much as possible, because we're not allowing volunteers and other people in the building, and we're trying to keep that cross contact down. As far as providing the mask with the see-through mouth area for all the staff, we were looking at that earlier this week, and we'll continue to do that. It's a matter of, can we get the number of masks for the number of staff that would want them, just because everybody in the country obviously is ordering equipment right now. We have, for the most part, all of our stuff is in, most of what we need, but the clear mask through summer school, that's one thing that we've learned. They are really good. For the 2 days a week that students will be streaming into the classroom, does that mean there will be a special camera streaming set up? Does it mean they'll join the live class using Google Meet? It's actually a combination of both. We will have the webcams for the classroom so that you get a better video quality, so that you can set the camera back away from the, pointing at the teacher, not the full class, pointing at the teacher while they're teaching. The teacher can be in Google Meet, share their screen, and when they share their screen, you'll be able to see the teacher, on the right-hand side teaching, and then you'll see the full screen in the middle. And that equipment is, we also have audio, because one thing that came across again in our focus groups was that a lot of the devices we were using, the audio was not clear. We especially heard this from our special education families, EL students, that our audio needs to be better, so that you will be provided with audio as well. Along with that, I'll just mention, I haven't seen the question, but elementary was very loud and clear that they don't have laptops at all. And so we have taken care of that also to make sure that they have something beyond just the iPad. It was very difficult for them to generate content. So is a hybrid approach being considered for elementary? Right now, as of today, and I know I've mentioned this, but there really has not been a change in how they're viewing elementary and middle. The change has really been more at the high school level. And today it was mentioned that even if a district considers elementary or middle, or goes full remote for a district, full remote, you would lose state funding or really federal funding that they expect to get more of in the coming months. So again, the mandates have not changed, but I'm waiting on guidance. Again, it changes daily. We have a commissioner's call tomorrow, and I'm sure we'll get more official about really where they're sitting on hybrid or not. Families that are withdrawing and homeschooling rather than participating, can they go in and out of in the same way a remote learner could? Any parent who chooses to homeschool, they are completely homeschooling. So they're homeschooling, they're responsible for all of that learning. If they want to come back to school, absolutely, they are able to do that at any point in time. And the same again for those families that choose remote. And again, that's Connecticut. That's the restrictions that we have, the flexibility. So is there a plan for instrumental music? So starting the year with our K-5 and 6-8, in order to get a schedule where our cohorts have minimal movement, that we don't have mixing across the whole building, our music will definitely look different, and the principals will be communicating more about that in the coming weeks. We are really starting the year very careful. We're not having after school activities. We're not having volunteers. We're advised not to have students blowing on band instruments or singing in chorus, where the droplets are more likely to be exposed when students are singing. So we're modifying school schedules again to start the year. Doesn't mean we'll stay that way all year, but we're going to be very careful because we're trying to get our doors open. Yes, the digital tools. Somebody's asking, it would be helpful to have a list of available digital tools sooner rather than later. And again, on our school planning page, we will be getting those out. And I know, Mark, do you want to mention anything about digital tools, or do you want to wait? Are you putting more out next week?
Well, we're doing two things, Tony. One is we're revamping our website. So we're working behind the scenes to present two different access points. One for parents, because we think it's important to provide parents with how-to so that they know how to use each of the digital tools that we're going to be asking teachers to use. And then we will have a teacher access site as well. We'll also have a hot link inside of Aspen. So the moment you log into Aspen, it'll immediately take you to the digital tools. We're just fine tuning and finishing some contracts right now. So I think it's best we wait about a week or so until we know everything's under contract, and then we can go ahead and publish the list of digital tools we plan on leveraging this fall.
Great, thank you. How are remote learner teachers chosen? The first aspect for a remote teacher is going to be teachers who need accommodations, that have worked through HR, but they're still physically capable of teaching. An example may be a teacher who is high risk because they've just gone through cancer treatment, but they're fully capable of still teaching. That would become a remote learner teacher for us first. Then we have teachers who have also said, I would love to remote teach if the opportunity is there, and that will get more into the students that opt out. What levels, what grade levels, what content areas do we actually need remote teachers? In elementary level, it's more likely to be a remote teacher who's teaching those students all day, just like you would see in a regular class. In secondary, it's likely to be some remote and some streaming, especially in those areas where we may not have a content teacher available. We may only have so many teachers and they're both on site at the school. So if the high school student has the same schedule in person or remote, why the need for the 2-week window? We've put a 2-week window in there to be as safe as possible so that we're very transparent, because we don't know what the fall is going to look like. You know, we have a lot of people who are still very concerned that we have a lot of students who haven't enrolled yet because they're saying the housing market is really exploding in Greenwich, but our enrollment in general has not gone up. So right now in our pre-schedule, what we think we have, we look fine, and perhaps if a student chooses remote learning, they can still hold that seat. That would be pretty fast. It wouldn't take us 2 weeks. But if we get large enrollment in the fall and we're trying to balance our remote learners with our face-to-face learners and keep those class sizes down, it may take us 2 weeks just to try to get a brand new schedule built for a student, again, based on the amount of in and out that we could see. And that really, the 2-week window is simply, it's a cushion so that we're being very transparent. If we can do it in 24 hours, we will absolutely do it in 24 hours. Buildings that don't have windows that fully open have poor ventilation. I've talked about this at our planning meeting. Every building is different. Some have window units, some have the large HVAC that circulate throughout the building. We did go in and look at the level of filter that we have. We use a MERV filter of 9 or 10. And, you know, for COVID, they would like us to be 13 or 16. It's not possible in our units. And it's kind of like if you think about it in a mask, you get a lighter mask that you feel like you can kind of, the air moves freer through. Then you can get a really thick mask where the air doesn't move. So if we go with a higher level filter, it could actually burn up our units and then we wouldn't have them at all. So our ventilation is actually, it's good around the district, but it is different in each building and each space. And if you have windows that can open, as long as you don't have students, again, it's a totally different issue, but for allergies, you'll be able to open the windows, which, you know, in the past, that's been more of a challenge. And I will say some of our COVID practices definitely are contradictory to some of the things we've been doing for well over a decade for school safety. When you talk about open doors and open windows and, you know, locking doors, like your classroom door, propping it open so everybody doesn't have to touch the doorknob that comes in. So there are gonna be some things that are conflicting, and we'll be doing a lot of training in the beginning of the year for that. We have well over, I think, 100 questions. And so we will take all of these questions. We have about 2 more minutes. And we will take all of these, make a document out of them in order to make sure that we get your questions answered. And again, this really does change daily. And I will keep you updated. We'll have a family note again tomorrow if we find out anything new. But again, and probably the biggest fluid situation this week has been the hybrid and the ability to go to a hybrid or not. And Karen Hirsch is the Board of Education rep. Do you want to take the last minute? Do you have anything to contribute?
Sorry, I couldn't find my unmute button. I just wanted to, thank our educators and other, staff and administration who have really spent so much time and energy focusing on making sure that our students have the best experience within our schools, whether they are within the school walls or learning from their home. I know that a lot of questions and concerns have been shared, and please do keep sending them in. You can certainly share them with us as the Board of Ed. as well as with Dr. Jones and the administration. And I just really wanted to thank you guys for all the hard work that you have put in so far and what's coming for the fall. We know that you guys are the heart and soul of our district. So thank you.
Thank you. And we are going to exit this meeting, and all the panelists are going to hop on the community meeting now. So, and thank you to our staff. I know this is not easy, and we thank you for your patience, and especially with everything that changes, it seems like on almost a daily or weekly basis. But our goal is to keep everybody safe and secure, and to try to have the very best opening we can in September. All right. Thank you. Have a great night.